So we're going to talk a little bit about longer form journalism, not so much the person on the bridge where you're making the in-the-moment decisions about coverage and trying to keep all these things in mind, but when you have more time to really dig into an issue. And I'm going to maybe click this.
Yeah, I can click this. Let's see.
Oh, it's an IQ test.
There it goes.
All right, so the main thing, of course, we all deal with is time and resources. So when there's a sensitive subject like suicide, where there's so many ways to get it wrong, where you want to take the time to really dig in and become an expert for your readers or your viewers, you know, there's always something more urgent. And so one of the issues we all struggle with is dedicating the time to these longer stories. We've talked about stigma and reluctant sources. The stigma around suicide, we all know. It's so great that even Oregon's landmark assisted suicide law, they went to the legislature and got a law that said it's not suicide if you use aid in dying, because they were so concerned that people would not take advantage of this physician-assisted death because of the stigma around suicide. So they went to that degree to make it technically and legally not a suicide. Reluctant sources, you know, not every family wants to go out and start a foundation or talk openly about this. Maybe they want to talk, but they don't want their name to be used. And as journalists, we want fully named, fully known people talking about their stories. The world has changed too. I call it the Google effect, that years ago, somebody might talk to us, and it would be in the newspaper and then gone. And it would take a little bit of effort to go into the archives and find that story. But now, you just Google somebody's name, and up pops potentially something very intimate. They may, you know, be sorry they brought it up. It may have effects that they didn't realize. And then you're faced with the question of what to do about that. We've dealt with this in just very innocuous things. We used to have a feature called My Workout, and it would talk about somebody's exercise routine. And a woman called years later and said, you know, I talked to you about my depression and how rowing or whatever it was that she did helped with that. And now I'm looking for a job, and I don't want that on the internet. And so the Google effect changes these conversations in newsrooms as well. I added the fear factor and discomfort there for all the reasons we're talking about. You know, we all know we can get this wrong. We all know that potentially we do more harm than good, and so it's just easier to do more clear-cut stories and move on. The contagion factor, I was glad to see the data, because I think in newsrooms we wonder about that, or maybe have skepticism around that, and you know, is that really a concern? And then Les may want to talk about, you know, the issues around addiction and the mental health system, that whenever you talk about suicide, I think you have to talk about mental health. And, you know, these are problems that just don't have easy solutions in terms of resources and help for people struggling. So the Vista Bridge story came up, and I want to talk a little bit more about that. We do have this thing in Oregon of hiding in plain sight. You know, we have more people dying of suicide than car wrecks. If you pick up the newspaper, you see the effect of fatalities on the roads. You see that it's a problem. It may change your behavior. You may wear your seatbelt, but you don't pick up the paper and see that Oregon consistently has had a higher rate than the nation in terms of suicide. And solutions are not always simple. We will talk about the Vista Bridge. Oops. This was actually, somebody thought 5 years ago, this was 2009 that we did this story. And this story was then cited as the reason that the city put up the barriers. I would say a couple things. One, it's the power of local journalism, because this actually started with the Northwest Examiner, which is a small Northwest Portland community paper, and they did a very well done story about this. Now, I grew up in Portland. I heard Suicide Bridge. I remember my dad, who was a psychiatrist, getting called after it was on the front page, I think, of the Oregon Journal, a woman trying to hold her husband back on that bridge. And a photographer happened to be going by and took pictures and ran on the front page of the Oregon Journal. And the newspaper was calling about what people should do when they see this. So I grew up with Suicide Bridge. That's what everybody called it. And when this story came out in the Northwest Examiner, one of our editors came in and he said, this is really well done. We should do this and really dig deep into this. And I thought, it would have been easy to say, nah, it's been done. Somebody already did it. Too derivative. Don't want to look like we're copying them. But I was thinking about another piece of journalism, which was the New Yorker, and they had done a very in-depth piece on the Golden Gate Bridge and the effect of barriers and other things. And they had also talked to people who survived and talked about that regret the minute that they went over the edge. And so we did assign journalists to this story. It did not run on the front page. It ran on our Sunday long-form features section. So the barrier issue was known then, but the very same conversation was happening about, oh, it's a historic bridge, it's beautiful, everybody takes pictures, and we don't want to ruin the pictures. The video that went with this, and I want to play a little clip of it if we can, maybe just the first, I think I gave you minute 2 to minute 4, somewhere in there. So go ahead and play that. The video is hard to watch. It's 6 minutes. These 2 minutes are not as difficult, but we focus on people affected by suicide.
Many times over our lives, trying to figure out what it would have been like if our father had lived. I always felt I was a child looking in other people's lives, wishing our life could be like that, but it never was. And I have thought of suicide myself many times. I'm very aware of this problem.
I have a history of suicide in my family. My grandfather committed suicide on my dad's side, and then my dad committed suicide too. When you commit suicide, all you do is screw up your family. That's what I found. I worry about young people committed suicide because they don't know what's going on. But sometimes I think people look at the future of the world and they think in their life and they just can't comprehend that. And it's just, is it worth it? Is it worth all this pain and so forth that you go through when you're young, you know?
Years ago, my husband and I were driving down a road and I saw a man dart out across the 3 lanes, and the car, which was probably about 6 or 7 car lengths in front of me, hit the man. I ran over to him. He immediately started saying, "I'm so sorry, I'm so sorry." He looked into my eyes and he said, "I didn't know what else to do." But as soon as the action was taken, then the awareness came over him about what he had done. It was a very powerful experience, knowing about my father and the suicide he contemplated and carried.
So that, I look back on that story and that video now, knowing all the things we know, and there are probably all sorts of, errors or things we could have done differently or better, but it did have an effect, which was the city council cited that coverage as the reason to put up the fence. The fence has prevented loss of life. The neighborhood has come to terms with it. People still go and take their pictures. So I think all in all, it was good coverage in the sense that it did draw attention to something that had been hiding in plain sight. Everybody talked about it. Everybody knew about it. Bud Clark was quoted there in part because at the time he was living in the Vista St. Clair and had a view of the bridge. But he also, as you know, ran the Goose Hollow Inn at the base of the bridge. And his wife, once, they were our neighbors when I was growing up, and his wife was driving under the bridge and a person fell right in front of her as she was heading to the Goose. So that effect on the community is really, really powerful. We deal in our newsrooms with this issue from several respects. As a workplace, we have people who have lost family members, ethical debates, which I'll talk about in a moment, about coverage. And we sometimes get phone calls from people in distress. I have actually, called the Florida cops to do a welfare check on somebody when he had called our newsroom. He had been molested as a child. He was trying to find somebody from his childhood, and he sounded very upset. And I said, "Are you thinking about hurting yourself?" And he said, "Yes." And I got his address, and I sent the police to go knock on his door, which they will do. They will go check on people if there is a concern like that. And so another thing for newsrooms to think about is when we get those calls, what do you do? The stakes are so high. I'm going to show a picture here that is hard to look at, so I'm giving you a graphic image warning, and I will move it quickly off the screen, but I'm using it. It did run in our newspaper, and I'm using it just as an example of the issues that we all as journalists have to deal with, so I'll just move quickly past it. So the picture that showed the people hanging off the bridge, that was a case where 2 young people hung themselves on the steel bridge at rush hour where the light rail train goes by, all the commuters go by. And it was a very difficult conversation in our newsroom because it was one of those very public things, but also that young couple had left a note saying that they had done this to draw attention to the heroin addiction crisis and the lack of treatment. They were both heroin addicts, and they had struggled off and on. And so their intent was wanting coverage to draw attention to this. We had 3 pictures. We had a picture that just showed the personnel on the bridge. We had that picture that showed a little bit of the police looking. And then we had the full picture of the 2 people hanging from the bridge. And we chose the middle ground. And I was talking about this ethical debate at a journalism conference in July in Colorado. And I was very struck by a college student, journalism student there, who said, "I would have run that full picture without hesitation." And I said, "Why?" She said, "I'm from a generation where everything is 1 click away on your phone. I have seen everything. I have seen every graphic image, everything. Doesn't faze me. That's my world." And I thought that's very interesting and has implications, I think, for us as journalists. When people, it goes to the, if we don't say something in our story, somebody will just Google it, move to another news outlet that does give them full details. People have the world at their fingertips, so what do you include and what don't you? The investigative topics that, come along with this, we talked about mental health, guns, very hard to talk about without polarizing people, but older men who own guns and older men have a higher suicide rate in Oregon. The gun issue is an important one to talk about. Opioids, the connection between the opioid crisis and suicides. So I'm just going to end it here and just say that, we all remember San Francisco, the homelessness project, where all the media in the area collaborated to write about the issue, and that may be a model for us on this issue to think about, because this is the reality for Oregon and has been for decades and decades. So.
Well, I don't have anywhere near the formal presentation that Therese does. I want to make maybe 3 points, and I'm really more interested, frankly, in the dialogue than having you listen to me. I want to double back to the dialogue we were having earlier about what to report and not. I want to underscore what's the obvious, but sometimes we don't state the obvious, that the fact that you even think these questions through is step 1. You will not always make the right decision, but at least if you walk away from this having a higher awareness of that the issue even exists, that's a success. I think it'd be foolish of any of us to walk out of here and think that we are suddenly experts in suicide reporting. Secondly, I have the joy of having been working for a huge news organization, having endless time, to one where I got to cut payroll checks while I'm editing an obituary. But the lessons I've learned at the Mental Health Enterprise, I think, apply to all of us, that the topics we're talking about, we all have many, many stories and issues that we need to confront. And it is very easy for us as journalists to sort of get our gears locked up and say, well, I just don't have the time. This is a topic that allows for breaking the pieces down. We don't have to report on every single element of suicide prevention, for example. We can focus on one element. And I think that's important for us to make any progress to move forward on reporting, number one. But number two, it's also for the ability of our readers and viewers to digest what we're telling them. If we give them too much on a complicated, sensitive subject, we overwhelm them, they move on, and all the work that you put into the reporting has been just typing practice. And I know as I think about Malheur County, it's the poorest county in Oregon. It's literally in another time zone. I have 2 reporters, but suicide is a significant issue in my community. We have farmers who are killing themselves. We have teenagers who are driving out onto the rangeland in their pickup truck with their dad's hunting rifle, committing suicide. In a small community, you cannot hide that information. That moves at light speed, whether we want to report it or not. It is a fact of life that the community knows about it. So in a smaller environment, that doubles the pressure to sort out how do you approach these issues and how can you be of service to the community. And we wrestle with that constantly. And frankly, we don't report suicides, but we do think very hard about how can we bring value added, so to speak, to help the community that is talking about this issue at the Starlight Cafe and at the Sagebrush Saloon. So my encouragement is that no matter what your size of your newsroom, that as you look at these stunning numbers and the cost to Oregon and Oregonians and to the families of this crisis, how can you take a piece of it and just move the ball 5 yards? You don't have to score a touchdown with every project on this. I think sometimes we think, well, I mean, it's either all or nothing. Well, if it's nothing, we haven't done our readers and viewers any good. The other thing that I think to consider, and this Therese mentioned this, one of my last projects with the Oregonian was to do a really deep examination of how the state was taking care of the addiction issue in Oregon. In other words, what was the state doing with the millions and millions of dollars that it was getting to supposedly tackle this issue? And that's a separate topic. But what that sets up, though, is that the issue of suicide prevention really is a mental health issue. And I think everybody that walks the streets of Portland or Salem these days knows the incredible crisis we have in this state with dealing with the mentally ill. We have not solved that issue. And it is reporting on that topic and the components of it, of the addiction, of the heroin, of all the stressors, that if we as reporters, as journalists, as investigative reporters point out the gaps in our system, where are the holes, to put the attention on those holes and compel government and political leaders to do something about it, then we're going to be doing our job and making the state a lot better.
We've talked a little bit about this being a wedding, and we have a lot of journalists here, but we have a lot of non-journalists as well. And so I was hoping to share with this audience, the non-journalists in particular, a little bit about what we do, particularly in looking at in-depth reporting moving forward on suicide. And, there are great opportunities here to talk about hope and recovery, and I think a lot of us will walk away wanting to tell those stories. But the challenge is, and we've dealt with this in the past, there are issues of confidentiality. It's something that a lot of people may not want to talk about publicly, and there may be a lot of shame and embarrassment. So I think we'll lean towards you folks in looking to identify people who can maybe help us tell those stories, families or individuals that are willing to share their stories. We think about other situations where there are survivors, whether it's a cancer survivor who posts on their Facebook page, I'm proud that I survived and I'm happy to tell the world about it. In these situations, people are not posting on Facebook that my son tried to commit suicide. Luckily, he survived and he's thriving. And I hope that we can share those stories, but we need your help, and it really is a two-way street. Hopefully, you can help to identify those people, bring those stories to us, meet with us individually as reporters and say, listen, I have this wonderful story to be told in long form, on TV and print, etc. Or when we call, if there is a high-profile celebrity who commits suicide and we want to tell that story of hope and recovery, we can turn to you and say, we really need to tell a story of an individual who has overcome this challenge and a story of hope and recovery. So that would be really my message to this group, the non-journalists in particular, that we need your help because it's difficult to find these people. It's difficult to get them to open up. We're certainly compassionate. We're humans in dealing with them, and we will be so. But in identifying them and making that initial contact, you play a really, really important role. And I hope that we can continue some of this dialogue. That maybe I'll start with a question, if that's okay. You know, investigative journalism, a lot of it depends on data, and you talked a little bit about the data that's out there. What pitfalls should we be looking for? What in the data either is not covered or should we question when we look at the data, generally speaking?
It's a, you know, and I would actually ask the experts to help you understand the data. You know, sometimes, for example, when we hear, you know, there's been an increase in suicides, you know, that's 10% among kids, you know, who are under 14, something like that. That is very alarming and something we have to pay attention to. What does it actually mean, though? So look at the population rates. You're still talking about a still incredibly rare incidence. What is absolutely real, though, is this statistic, which is much bigger than the number of kids who are killing themselves, is the number of kids who are thinking about killing themselves, and the number of kids who are actually attempting suicide. It's the highest rates. If you're going to talk about any time that people are more likely to have an existential crisis in their life, it is adolescence. It's clearly what the data shows. Who am I and what I mean in this world? And it is a time where misery can be visited upon many a young person. So the question is, what can we do to help kids cope through that and that period of life? Because if we can help them understand in this learning period in their life how to take care of themselves, they're not going to be the suicidal adult later. So seeing it as an opportunity and focusing less like, okay, so you know, I would steer people away from, yeah, we're concerned about the number of kids who are killing themselves. What we really need to be concerned about is the number of kids who are thinking about killing themselves, who could kill themselves later. What can we do to prevent that? So that's a different conversation when we say, because typically the question is, well, we see an increase in suicides, and again, 10% might mean that there's, instead of, you know, 5 kids dying by suicide, or 10 kids dying by suicide out of 100,000, there's 11. That's alarming, but what's really alarming is when you say, you know, and 1 out of 6 high school kids are thinking seriously about suicide. That is a high prevalence statistic that not only if we pay attention to it, but that's an opportunity for prevention.
On the data front, I was thinking about the lag in reporting time for the official data that government produces for us, and contrasting that with, you know, recently we had a rash of overdoses in south of here in Oregon, and there was a public health alert, essentially, news release going out saying drug overdoses, be concerned, be aware, you know. Government doesn't really do that, and even I remember talking to the medical examiner about trying to get more current data on suicides in Oregon, and the medical examiner at the time said that that's not what we do. We're not a data organization. We don't collect data, really. They report once a year or whatever it is. So do you have thoughts about sort of that basic informational side, and if you were simply not telling necessarily the human story, but is it good, bad, indifferent to tell the pure data story of the numbers?
It's better to give, if you can, context to the stories. There's actually, and I'm thinking it's in Oregon. If it's not, it's in Washington, but I think it's in Oregon. There was recently a study done on there's the National Violent Death Reporting System, NVDRS, and that I believe either Oregon is using it or Washington, or both are. And there is a kind of a gap between, what happens is that the NVDRS data gets sent to the state and is put in a big file, and they just take whatever it is they want from it. And there was a woman, I forget her name, so it's with an R, who recently did some research on the difference between the actual data that the NVDRS is collecting and then what they report on. And what she found, for example, is that, and I think this is stunning, the things that we're missing if we don't dig further into the data. Things like that they found a number of people were giving their pets away right before they killed themselves. So what they decided to do in these areas where they were giving their pets away is start talking to, the places where they would be giving the pets away, the ASPCA, and if the person looked distressed and it seemed odd that they would be giving their pet away, ask them, what's going on here? Or how are you doing? And they found that there was a number of people that were suicidal, and they were able to help them. So if we dig a little bit deeper beyond the numbers and ask, well, what else is there? It's just a number. Can you tell us what this number means, and is there any more information you can tell us about these people who are killing themselves? The NVDRS data is a data bank that tells you all sorts of demographic information about the individual and some of their behaviors that were in some ways that people reported when they died. So if you can say, I want to learn more about this than just a single number, you actually can find out things that can actually prevent it from occurring.
So you've mentioned a couple of times the 1 out of 6 high school kids who are thinking about suicide. At this moment in time, is that the most surprising and alarming number of all the numbers on suicide? And should we be focusing on that, or is there another set or subset that's emerging that is surprising you and your organization?
That's a great question. That's really alarms me, and I mostly think that is such an opportunity for prevention, that if suicide is the second leading cause of death for our young people in health class, we should be aware that the biggest danger to them is not knowing how to deal with life. And so what we should be doing is teaching them coping skills, and a lot of this stuff is totally teachable. I mean, coping skills, conflict management skills, relationship health, and that stuff is interesting. Kids would get into that, but we're just not really doing much of a job teaching them. So the more we can do that, the better. But here's the other thing that's alarming, Les, and this is world over, is us men in my age group. We are highest rates of suicide, and it's really mostly us white guys. White guys, middle-aged, we have such a high rate of suicide, and males across the globe are typically about 4 times more likely to kill themselves than women. Actually, one of the things I appreciated about that show that I was watching last night, A Million Little Things, is that in the aftermath of this male friend who killed himself, they were all saying, we don't really talk to each other, we don't have real conversations, we have got to talk with each other. And so, it's not just teaching kids, but how do we reach, the bootstraps guys who say, I can handle this on my own. And actually, that's a big issue. Half of the people who have been seriously suicidal, who attempted to kill themselves, don't go to treatment afterwards. And they tell you, and the reason why they don't go is not because it's costly or even so-called stigma, though I think that is still at play, they say, you know, I can handle this on my own. My problem is not that big a deal. They've just tried to kill themselves, but my problem is not that. And you could see suicide is probably the ultimate do-it-yourself solution. So what we need to do is be able to provide people with more tools to be able to help themselves and help others. And that's a big mission of ours, is not just provide the hotline and promote that, but also teach people how to help themselves and others.
Okay, I'd like to follow up on Kyle's question too. You know, we're reporters, we're sometimes flying very hard. You start looking for experts, and there's, of course, a range of quality of experts and whether people are truly experts. What advice do you have for us as we're looking for people who are truly authoritative on some element? How do we vet? What's the question, or what should we be looking for, or what's a warning sign about who we should talk to and not talk to?
Oh, that's such a great question. And you know, you're right. Every profession has got their, you know, there's different gradations of knowledge, and I mean, we do have a list of you know, experts that we would suggest that you talk to. I think that's on the drive. There is, I mean, certainly talk with the folks from Lines for Life is just a great resource. But that doesn't really answer your question. Your question is, how do you vet, you know, that? And I'm not sure there's a, you know, you can ask a person, you know, do you, just like you would like a job interview, how much do you know about this subject? Is this an area that you're really comfortable talking? And when you're vetting, asking around, I would like to somebody who really is considered by people to be, you know, highly respected in their field. I want to make sure I'm talking to the right person. Are you the right person? And if not, can you tell me who I can speak to? And there's people I absolutely have referred others to when they've come to me, and it's just not my area of expertise. So, you know, my hope is that our job as the experts in some areas can tell you when we're not experts in this area.
Any questions or concerns from the audience? Yeah.
You know, yes. So a few examples. Kendra's Law in New York State was passed because of the news stories around a man who had paranoid schizophrenia who pushed a woman on a subway, in front of a subway. And the story, you could have just said, let's just jail this guy. You know, but what the investigative reporting showed is that he, Andrew Goldstein or something like that, I believe was his name, that he was a person who was lost in the mental health system. The mental health system had failed him. He was virtually homeless. Nobody followed up with any of his care. He didn't show up, so nobody checked on him. And so he was just a problem waiting to happen. And so what Kendra's Law, the writing about this, and then the family's advocacy, and they interviewed family members and things like that, and talked about Kendra and what a wonderful person she was, and how this just could happen to any random New Yorker standing on a subway platform. That is the kind of reporting that led to Kendra's Law, which has actually been shown to be effective. It's called assistant outpatient treatment that resulted, and there's resources behind it. Assistant outpatient treatment is actually kind of a civil commitment. You've got to, there's a team that follows you and makes sure that if you have a history of dangerousness to others, or you're high risk, that they're there to support you, not punish you, and they will be following up with you to make sure that you're connected to care, you're getting all the resources that you get, and it's shown to be very effective. That's one example. I know that there's others. I believe in Washington State, I know there was a lot of advocacy that's been done around training more professionals in suicide prevention. And there's an organization called Forefront that works very effectively with the media that was explaining how this needs to be done and how important it is to be done. And when they talked about, when it became apparent in the media that there was so many untrained mental health practitioners were saying, go take them to a doctor, and the doctor has no idea how to deal with a problem, that they said, there's something we can do about that. And so they do now require training of all professionals and also teachers. Again, this was an advocacy effort that was done in concert with the media.
Let me also just jump in to say there's an opportunity here because as some of you know, there are more so than any time in my involvement in this issue, which is just 5 years to be clear, I'm just a lawyer, remember, but there are 3 different significant legislative proposals bubbling up in Salem right now. One from the governor's, from Oregon Health Authority, which is about a $13 million investment in suicide prevention to implement the youth suicide intervention and prevention plan and to get school health counselors. Second, from the public safety task force that Sheriff Roberts chairs was established in the wake of the Reynolds shooting. And they have a proposal that would create an infrastructure in the education service districts to support schools in developing suicide prevention plans and implementing suicide prevention work. And then third, Basic Rights Oregon has a proposal around ensuring that schools have effective suicide prevention plans. So it's a funny collection of allies that I'm hoping to coalesce, but as you're thinking about where investigative journalism might play a role in the future, there's active policy action right now.
Yeah, and there's also a lot, I just want to throw this in real quickly, there's also a lot that's bubbling up around gun safety. Aside from, gun control, an area that people are pretty comfortable in agreeing on is that, well, we want to create create safe households where people don't accidentally kill themselves or purposely make it easy for them to purposely kill themselves with guns. So there is actually some articles that have been written about some gun safety programs that have been where suicide prevention organizations have been partnering with gun shops and effectively adding more gun locks and gun safety procedures and locking up your guns and instructing people who are buying how to make sure that they keep a suicide safe and an accident safe home.
Just wanted to, for 25 years I've had the fortune to run broadcast stations, and this subject has been difficult that entire 25 years and before. One thing Therese said a moment ago was a younger journalist saying show the whole thing, right? And which scares me a little bit. Then Craig and I did a bit of an internal poll with our journalists who we're hiring about what kind of studying is happening inside those J schools before we get there. And the answers were somewhat alarming. The University of Missouri spent 2 weeks on it. The Arizona State student said nothing. Is there an effort in J schools for the training that you're showing us today, and what does that look like?
So Bob, could y'all hear what Bob was saying? I can repeat some of the key facts. He was alarmed, like many of us, that when Therese was saying, just display everything, show those people hanging from the bridge, because kids are going to find that anyway. And I'm from a generation where we're going to find that and see that, and we should see that. And so not sure what to do with that. And so with this kind of young people in journalism school, what efforts are being made in journalism school to talk with them about suicide prevention? And to my knowledge, very little. And this is a huge area, Bob, for us to really be focused on, because that's where change is going to happen. I mean, it certainly can happen in newsrooms and through news leadership, but you're right. It's an area that has been really neglected by suicide prevention that we really need to address.
It has not been entirely neglected by suicide prevention, because Professor Nicole Dahman from the Oregon or University of Oregon School of Journalism is here. Do you want to answer? You didn't hear the question, so that's totally unfair. But the question was about where journalism schools are these days, because Bob was saying that his recollection and the recollection of his reporters is the answer was just don't do this.
Absolutely, it's a conversation we're having right now at the University of Oregon School of Journalism and Communication, and that we've been having at journalism educator conferences across the country. And what we're really doing right now at UO is learning everything we can about this topic. Dwight first reached out to us about a year ago, and it was related to some other conversations that we were having in our school about how to cover gun violence, because when Roseburg happened, our students were called to be stringers from news outlets across the country. We have students from Roseburg. So again, it's a conversation that we're having very broadly about what is the ethically responsible thing to do and the professionally responsible thing to do. And we sort of just keep going back at this point to the SPJ Code of Ethics and that dual moral responsibility of balancing seeking truth and minimizing harm. And we're really looking at both gun violence coverage and suicide coverage in that balance again. So, things about, avoid pandering to lurid curiosity, looking at specific language. And these statistics that have been shared today are absolutely phenomenal. So absolutely, it is a conversation we're having at the education level. And I appreciate being here today and learning more.
Thanks for being on the spot.
Are we going on?
No, you're good. You're good.
Any other questions?
Well, I have a question for you. I'm tumbling around what Therese finished her presentation with about, well, maybe there's a way we can all work together. So just let's take a little poll here. Who would be interested in doing a collaboration? Okay, so if you're interested, keep your hands up. Very quickly, tell us why. Let's just go around.
Talk about it being a national health problem, talking about it being something that we need to reach out to young people and reach out to everyone to make them aware that help is available. And like Kyle referenced, we as journalists need help to find those stories of survivors, because it sounds like that's very much an area where we can make that difference and get the word out to reduce those numbers.
Okay, there's a lot of hands up. Let's make this rapid fire.
It's a statewide issue. It needs a statewide journalism effort.
What I think would be amazing is the fact that, we're all under attack as journalists. We kind of feel it from people and what we hear on social media and just every day out in the streets. But if we come together for something like this, and that is so powerful and does make change that people can talk about, I want to be a part of that.
I know it sounds like a platitude, but we want to make our communities better, right? We all do. And if we can prevent one death, that's, we're making a dent. So I really believe in that.
We just all have different platforms, and if we reach different people in different ways, we'll just make more impact.
I've just been struck by this conversation today because I spent so much of my life in newsrooms and then ended up being a person who lost someone to suicide. And I was curious how many of you in this room have lost someone you know to suicide. It's ubiquitous. And part of, I think, the challenge in us deciding that we're going to continue to report and to relay these stories is allowing ourselves to be human and allowing ourselves to actually take a personal viewpoint about these matters that are happening in our neighborhoods and at our schools and in our churches and in our places of worship every single day. I feel like as journalists, we should be human enough to talk about the problems that are impacting our society. And I was looking at some statistics on the way back here and just thinking about, we've had a 30% increase in suicide since 1999. We've had a 50% increase in young women. And to me, it's sort of like if there's nothing more that we can commit to, we should be willing to commit to the lives of young women and young men. As journalists who've gone through that path and who can actually make a change for others, I think it's something we can really all aspire to.
Well, I think an interesting approach would be to reach out to every media organization in the state, frankly, and say, look, we're thinking about doing holding hands and working together to make a material difference. Find out, first of all, who's involved, who's interested. And then it's just going to take some organization to start throwing around story ideas, bring in the experts to give us ideas about what we ought to take a look at. Start framing what the elements are, because the trick is going to be able to divide up the labor in an organized way, so we're all making progress on the same thing and not stepping on each other. So, and I expect you'll just take care of it, Dwight.
I will try my best. And maybe what folks should look out for is maybe a starting point is we'll try and get an open letter that all of y'all can sign saying we're interested in doing this. Who else would like to join? Because part of the challenge here, and navigating it in this room is was something that I was really looking for, was getting past the fact that we have competitors, we're frenemies in some ways, right? And I think that it gives me goosebumps. Kyle and I had talked about this even before Therese raised it today. Kyle had raised it with me, this prospect of let's get all together as a community. So maybe look for us to reach out on that as a way to create that community that we're doing this together across all those other more day-to-day things that sometimes come up.
And I just wanted to note something that Kyle said too that I thought was really important. It really is incumbent upon us, Dwight, and we're fortunate to know a number of people who have what we call lived experience of suicidality or have lived through suicidal moments or lost someone to suicide, who we can bring to bear in interviews. But everyone, you got to have those local stories, and that there is the stigma and those concerns that you noted, Therese, and so I think it is very much incumbent upon our local crisis centers to be the hub for finding those voices, and also helping them find other success stories, the great work that you're doing and the work that they're doing in the treatment centers. And I mean, so people don't have to, hang themselves from bridges to say, nothing good is happening. Well, here's a story about something that's good that's happening. And so the more I think we can act as a traffic cop, because you're only going to hear about the suicides. We're the ones who know about suicide prevention, so we'll tell you about that, and I think that's really incumbent on us.